I'm Mike Huckman at the Bio Buzz Center, and it is a pleasure to welcome the President and CEO of the Biotechnology Innovation Organization, Mr. Jim Greenwood. Jim, great to have you here again.
Thanks for having me.
So what's the state of the state, if you will, this year here at the Bio Convention?
Yeah. So the convention is doing wonderfully. We have about 16,000 people here from, I think, 80 different countries.
Wow.
As you can see, the exhibit hall is just filled with pavilions from all over the world and all over the country and companies. We have had two great plenary sessions. I interviewed David Cameron, the former Prime Minister of the UK yesterday, and today Anne Romney, who has multiple sclerosis and has written a book about it. The other thing that goes on here is the partnering.
They're going on
right
at
there,
these booths
right there,
over our shoulder.
booths. And how that works is in the run up to this thing, if you want to talk to other people about collaborating, investing and so forth, you go into our system, you search for them by name, disease, molecule,
wow.
And if you say, I'd like to meet with you at Bio, and if they say yes, then our system automatically routes it, and it says, be in booth number 520 at 9:45 on Tuesday, and boom, there you are. And
so super streamlined and user-friendly.
Very user-friendly, and that's why it keeps growing and growing and growing.
You're at a record, right?
This year we think we'll put on 42,000 one-on-one meetings. I mean, that's an astounding number, right? And what that means is, I always think there's sort of the geometric growth that occurs here. You have 16,000 people come from around the world, all these smart people, scientists and investors and CEOs, and they all are sharing information and making arrangements and deals and so forth. And then they go home and biotechnology just went up 10 feet, right? So it's an incredibly useful tool. It saves a lot of jet fuel. A lot of these people would have to get in a jet and fly somewhere to have all of these, if they want a face-to-face conversation.
Yes.
And there's really no substitute for a face-to-face conversation.
So it's ecological and economical.
It is indeed.
All right. There are so many things that are going on, whether it's in Washington, D.C., where you used to be on the Hill, or in the outside world, if you will, that impact the life sciences sector. But to your mind, what is the biggest challenge right now that's facing so many of your member companies?
Right. And people would think maybe it's a scientific challenge. It's not. The science is galloping. We're learning more every second of every day. And we're learning, the more we learn it from here, somebody else picks up on that idea and they take the science even further. We're not lacking in entrepreneurs who are willing to risk it all and fail and get up and try again. And we're not lacking for investors who are willing to take that risk with them, knowing that 9 out of 10 of their clinical trials will fail, right? Now, but because 9 out of 10 of the clinical trials fail, there's a basic economic rule, which is high risk, high reward. So those investors know that 9 times out of 10 they're going to fail, and their investment money will be lost. So they have to recover it on the 10th one. And what does that do? It means our drugs have to be quite expensive sometimes. And people don't like that. And what's hard to control is that what people are really mad about is not so much the price, it's what comes out of their pocket. And we can't do anything about that. That's the insurance companies who decide what the deductibles and the co-insurance is going to be. So the result of all of this is a lot of anger, and it's facing us. And so we have a lot of proposals for price controls and all kinds of things to try to control the pricing.
Pay for performance.
Right. Now, pay for performance is a good thing. I mean, we think that rather than coming in and saying, okay, you can only charge this much for your drug, we can say, look, in the age of personalized medicine, not everybody does well on these drugs, right? So what if we say, look, it's expensive, but if it doesn't work, it doesn't cost anything. Or if it's a one-time cure, and now with cell therapy and gene therapy we can do that, maybe it has a value of $1 million, but maybe you pay it off over 10 years, or as long as it continues to work. And we're in favor of that kind of policy approach.
Jim, lest people think that bio is all about therapeutics, as you've been discussing, there's also progress being made and reported here at this year's convention in ag tech or food, as well as in what you call biomaterials. Tell us about that.
So DNA is DNA, and we can do all kinds of things with it, not only in humans, but in animals and in plants and in bacteria and even in viruses. And so on the agricultural side, one of the new products that came out is the Arctic apple. The Arctic apple doesn't turn brown. So
from a company called Intrexon, right?
Right, a company called Intrexon. So moms can send their kids to school with carrot sticks and celery sticks and so forth, but they can't send them to school with bananas because by the time lunch comes around, they're all brown, right? You can't put them on store shelves as already sliced apples. So the reason that apples turn brown is because they've evolved so that when they fall off the tree, they quickly rot, they oxidize, and the seed can then go into the ground. We don't need that anymore because we have orchards, and that's where apples come from. And still, 40% of all of the apples that come out of off an apple tree are wasted. They just go bad and they're thrown out. So this is going to be very interesting because most of the GMO stuff we've done so far has been about feeds, corn, soy, cotton. It's not directly consumer ingested, if you will. And so this is. And we're hoping that instead of people saying, oh, I don't want to eat it because it's GMO, they'll say, this is so cool, this is so much better.
Because it's GMO.
And it's as safe as can be.
And that's just one example of what's
Right.
going on. The theme, as you well know, of this year's convention is breakthrough.
Right.
Jim Greenwood, breakthrough to what?
Right. So in order to break through, you have to have an obstacle, right? And we have lots of obstacles. We have policy obstacles, and I've talked about that, and we literally have to break through that and come out the other side with this industry intact before it gets destroyed by bad policy. We have scientific obstacles, right? Why can't we cure multiple sclerosis? Why can't we cure Alzheimer's? And so we need to break through that wall, and that's the science that will break through that wall, and we'll come out on the other side, and we're going to beat these diseases.
Here's hoping. Jim Greenwood, the president and CEO of the Biotechnology Innovation Organization, here at the BioBuzz Center.